We're going to be talking about the future of treating lung cancer, in particular Brigatinib. There's two types of lung cancer. There's non-small cell lung cancer, which is more prevalent than small cell lung cancer. So around the world, lung cancer is the leading cause of death among both men and women in developed and developing countries. In 2012, there was about 1.8 million lung cancer cases diagnosed. It is the most frequently diagnosed cancer in less developed countries. There's a higher prevalence of lung cancer in North America, North and Western Europe, Australia, and New Zealand. In Australia, there are more males diagnosed with lung cancer than females. Cells possess EML4 and ALK proteins on their membranes. Genetic alterations between these proteins create an oncogene. This gene increases kinase activity, resulting in tumor formation. Non-small cell lung cancer inhibitors mainly target kinase activity produced by the fusion gene.
Crizotinib was approved by the FDA in November 2013. It was the first drug to specifically target ALK proteins, and it inhibits phosphorylation of ALK and signal transduction. Crizotinib affects the cardiovascular, nervous, and gastrointestinal systems. Increasing resistance to crizotinib is due to gene mutation in the oncogene. Other limitations include poor penetration to the CNS.
Second-generation ALK inhibitors include cretinib and alectinib. They both feature a higher selectivity for ALK inhibitors than crizotinib. Cretinib is 20 times as potent. It has the ability to treat crizotinib-resistant patients and crizotinib-sensitive non-small cell lung cancer. Adverse effects include nausea and diarrhea and elevated alanine aminotransferase levels. Alectinib reduces cancer progression by 53% than crizotinib. It also treats crizotinib-resistant patients. It has a better penetration to the central nervous system and prevents brain metastasis. Adverse effects include a lower incidence than that of crizotinib.
Brigatinib was approved by the FDA in April 2017. It is a second-generation ALK inhibitor that has a broader spectrum of activity than mentioned drugs, with potency up to 77% fold of that of crizotinib. It mainly inhibits autophosphorylation of ALK, inhibiting signals created by mutated kinases. It's metabolized by cytochromes via N-demethylation or cysteine conjugation. The preclinical trials showed that Brigatinib can easily penetrate through the blood-brain barrier and inhibit 9 different mutants out of 17. Its effectiveness relied on the dimethylphosphinoxide on C4 aniline that exhibits selective potency against ALK. Phase 1 clinical trial showed 60% objective response with Brigatinib in patients who never used crizotinib, whereas it showed 100% objective response in crizotinib-resistant patients. Objective response being improvement in patients' health and increase in survival rates. The trial's main outcomes were effectiveness of Brigatinib against multiple ALK variants and its activity in the central nervous system. Phase 2 trial proved that Brigatinib was active in the CNS and led to whole body improvements with increase in survival rates. The recommended dose was 180 mg once a day rather than 90 mg. However, Brigatinib is still limited by adverse effects it causes, its inability to fight all ALK variants, and its cost, which is estimated to be around $85 per tablet. Brigatinib poses both clinical and social impacts. Clinically, the discovery of genetic mutations in ALK led to focusing on specific targets. ALK inhibitors are designed to become more selective. The genetic factor of lung cancer may lead to enhanced techniques in genetic therapy and screening. Socially, Brigatinib may provide access to patients with relapse due to mutations. It can also offer more affordable treatments than chemotherapy. This would lead to a decrease in undesirable syndromes and improve patients' life quality. All in all, Brigatinib is a more selective and potent ALK inhibitor that can target specific ALK mutations in non-small cell lung cancer, which may contribute to the next step in treating lung cancers globally.